Sam Petto, I'm the Communications Director at the ACLU of Nebraska. I'm really grateful for all of you being here. I'm grateful for Planned Parenthood North Central States helping pull this together, along with the Women's Fund of Omaha and Ivy Black Girl. Quick clarification note is they help plan, but they cannot be here today because of health precautions. So I just want to help make sure you all had that note from the advisory. But we're going to get things rolling, and we'll have time for questions at the end of it. But we'll start with Senator Megan Hunt. Thanks, everyone.
Thank you so much to members of the press for being here. Thank you to our community members for being here. This turnout is really incredible, especially given that we haven't even started session yet. So just seeing the people of Nebraska already activated and already engaged in this issue is so encouraging to me. And I think it says a lot about where the minds of the majority of people of Nebraska are when it comes to reproductive justice and reproductive health. First, let me be clear. Abortion is health care. It is safe, and it should be treated like any other healthcare service. It's also legal in Nebraska and has been an established fundamental right in this country for decades. All of us here today and all of us in the legislature care deeply about privacy and bodily autonomy and reproductive freedom, those of us here, which includes life decisions about whether and when to become a parent. That's why we must do more to ensure that everybody in Nebraska can access these fundamental rights. As we gather here today, we also know that the future of reproductive rights in our country and in Nebraska are uncertain. There's the Mississippi case that's pending before the Supreme Court, and there's of course the infamous Texas law that's being litigated in the federal courts. And it's unclear what exactly might be introduced in the Nebraska Legislature this session, but it is clear to me that some of my colleagues will continue their relentless attacks on abortion rights as they have year after year. They might even pursue even more extreme and more harmful abortion bans this session, as we have seen in other parts of the country. However, it doesn't have to be like this. I'm calling on my colleagues to choose a less divisive path. We have to remember that abortion is a right. Abortion is health care. And the decision about whether and when to become a parent belongs to Nebraskans in consultations with their medical providers and their families and their faith, not with the government. Once a person makes a decision to end a pregnancy, Nebraskans can't shame or stigmatize our neighbors because we have no idea what it is to walk in their shoes. And above all, politicians have no place interfering with the personal health care decisions that belong between a patient and a doctor who's trying to tell them what the best standard of care is for them. We aren't medical experts in the legislature, and we don't know any better than doctors or the patients themselves. However we personally feel about abortions, individuals, not lawmakers, not the government, should have these opportunities to make these decisions without political interference. So we are all here today to announce some new efforts to expand access to abortion care in the 2022 legislative session. Because when somebody needs abortion care, they should be able to access it in Nebraska because that's their right. And when you have rights without access, you can't really do much with that. So we want to be proactive and make sure that patients in Nebraska can access these rights. This effort will focus on 3 bills, 2 that I plan to introduce this year and 1 that will be carried over from last year. Each one of these bills aims to expand access by removing medically unnecessary barriers that state senators have previously put in place. And many Nebraskans, whether we're talking about Scottsbluff or North Platte or Omaha, like all over the state, they don't even know about these barriers to care until they personally have to deal with them. And that's when they're in a time of crisis. That's when they need the care the most. And so we want to make sure that the lawmakers in Nebraska who are making these decisions are not standing in the way of the health care that they need. And by removing the barriers created by these laws from the past, we can ensure that everybody can make their own decisions about pregnancy and enable our families to thrive. First, I'm introducing a new bill that would remove a requirement that Nebraskans must purchase additional coverage from their private insurance to cover abortion care. Cost is often typically the biggest barrier to access to any kind of health care, including abortion care. And in Nebraska, private insurance policies can only cover abortion in cases of life endangerment unless you purchase an additional rider at an additional cost. many other states, including our neighbors in Iowa, that's just not the case. However one feels about abortion, politicians should be allowed to deny coverage for necessary medical care. All of us should be able to make decisions about our health and our future with dignity and with economic security. And that's why we need to remove this completely unnecessary, completely politically motivated ban on coverage. Second, I will introduce a new bill that would modify provider requirements so that certified nurse midwives, APRNs, advanced practice registered nurses, and physician's assistants can provide abortion care, including medication abortion. As it is throughout the entire healthcare field, reproductive health providers are in short supply, and many of the duties that are currently performed by physicians can also be performed by APRNs, by certified nurse midwives, and by our skilled physician's assistants. We know that our healthcare providers in Nebraska are of course qualified and trained to do this kind of care. Medication abortion is a safe and effective way to end an early pregnancy. And just last month, we saw the FDA recognize the safety of medication abortion by permanently authorizing abortion medication via mail. Studies have repeatedly shown that the safety of medication abortion is there. There's no risk to the patient more than any other medical procedure. And it's time for us to update our laws in Nebraska to support patient health and access, bringing Nebraska in mind with many other states across the country, including many of our neighbors. Finally, I will be making every effort to get LB 276 to the floor, which I introduced last year. LB 276 repeals Nebraska's ban on telemedicine for abortion. There is no medical reason for Nebraska to ban telemedicine for abortion care. It's a purely political ban that we have. Many Nebraskans have seen the news about the FDA permanently allowing medication abortion by mail, but unfortunately, because of our unnecessary ban on telemedicine abortion in Nebraska, this federal policy will not increase access for Nebraskans. Under current Nebraska statute, all treatments and consultations that do not involve a physical procedure can be performed through telemedicine, except for medication abortion. It's literally the only procedure in Nebraska that cannot be done via telemedicine. And we know that this disproportionately impacts rural Nebraskans, low-income Nebraskans, and Nebraskans of color. Our laws require patients to be in the same room as the medical provider, even if they're just going to take a pill and go home. There's no medical reason for that. It's literally not the standard of care, and that's not the best way that the medical, industry, that medical experts have found to take care of patients. And so this is a barrier that we definitely need to remove, just to make sure that we are providing that standard of care for patients in Nebraska. For some patients who have to drive hours across Nebraska to see a physician to go through this procedure, this constitutes an undue burden. Every Nebraskan should be able to get the care they need, when they need it, in their own community. Nebraska is already a leader in telemedicine, and our reproductive health care options should reflect that. Again, abortion is safe and legal. It's that way because we trust our medical providers in Nebraska and in the United States to give this standard of care to patients. And the thing that would make it unsafe is politicians coming between those medical providers and medical experts and the patients that they're trying to do the best work for. As long as I am in the Nebraska Legislature and beyond, I am committed to doing everything I can to protect the rights of women, children, families, doctors, and ensure that we are enacting policy that is motivated by evidence, and motivated by research, and motivated by best practices and medical facts. Thank you very much.